Dr. Malone, April 15th would be tax day except for this virus. Fortunately, we got a reprieve from that till July. So at least for now. I know you have some stuff to report. I wanted to, you and I spoke earlier today. I caught a little bit of the Secretary of Defense's press conference. No, it wasn't a press conference. He was on Fox. He was being interviewed, I think, by the morning crew at Fox. They were asking him some questions that I had not heard being asked of other officials, and I thought were interesting. They were asking some questions, first of all, about the North Vietnamese folks testing rockets, evidently, which I wasn't aware of. They were doing, and is that being monitored? And of course, the answer is yes. And then they were asking, are we ready to defend ourselves against an attack? And he said yes. And he basically suggested that everybody in sensitive spots, like the folks underground in control of the nuclear arsenal here, 100% of those people are being tested like every day, and they're making sure they're not spreading the virus anywhere. And then they got onto the Teddy Roosevelt carrier, and this is where some really interesting information struck me. He said pretty much everybody on the boat had been tested, which is, I think, thousands of people. And that his point was, and nobody else has made this point very well, his point was that most of the people that tested positive, which I think were 600 and some change out of the 5,000 or 6,000, whatever they got, were asymptomatic, which is significant in my opinion, because it's the first time I've seen a geographic location, I'll bet a very compressed one, but a geographic location has basically been tested as a whole. And we've got data on those people that suggests that of the people that are positive, a majority of those are asymptomatic, which should be somewhat alarming to anybody thinking about giving up social distancing and giving up all the other precautions we've been taking, because if most people that have it are asymptomatic, then how in the heck are you going to know who you're dealing with or not, unless people are tested and know that they have it? So, and then the question becomes, if somebody tests and they're asymptomatic, who's going to police them? And who's going to make sure they don't get out and just go around anyway and be a spreader of this virus? It's not like we can put a scarlet letter on them or some kind of marker on them that says they're positive. Who's to say they're going to, they feel fine, they want to go hang out at a bar or whatever? We can't control that. The only way we can control that is make sure the bar's not open,
or make sure they're in the military. Make sure they're in the military on a submarine.
Right. Or the other way is that we test everybody, and then everybody can, I guess, find out quicker if they get it, and then the responsible people will stay at home, I guess. So the asymptomatic carriers are the ones that I think could basically allow this thing to spread and harm not me and you necessarily, but people that are at risk. I mean, I don't know if we want to be doing that. Who do you think is taking care of the people in the nursing homes and the long-term care facilities? Those are not other elders. Those are 20-something-year-olds to 50-year-olds, maybe 20 to 45-year-olds taking care of these people. And if they're asymptomatic carriers, which I guarantee you, the way this virus gets introduced to these places is asymptomatic carriers, most likely, and they're taking care of our elder population in these facilities, how are we going to control that without testing, significant testing? And in that circumstance, the employer could test, and if somebody tests positive, you're not coming back in here until you test negative. Now, there's a way to control that, right? If I had testing available to me, I could test everybody in my office before they walked in the door, and maybe do it 2 or 3 times a week and make sure nobody's in here making other people sick. If new clients show up at the door and they want to meet with me, and the ban is off, and we say, well, unfortunately, you got to do this test before you come in the door, and they do the test, they test positive. I'm like, I can't see you. in person. You have to see you virtually, like we're doing right now, like we did today with a couple of new clients. But I guess what I know you did some more in-depth research into this. So if we could maybe start off with that, I think it would be helpful.
Sure. So I found a publication. It's called Government Executive, and they seem rather authoritative with the data that they have on there. So when Joe tasked me with this today, let me get this pulled up here. So this is today's publication, April 15th, and the Navy COVID update. So as of today, 94% of the crew members on the Roosevelt had been tested, with 615 positives and almost 4,000 negatives. And the sailors have all been moved ashore. And the next paragraph down is 5 of those sailors. So 5 of the 615 are hospitalized because of symptoms. And of those 5, one of them is in the ICU for a close observation.
Well,
so,
I guess that could mean that only 5 had bad enough symptoms to be admitted. That doesn't mean there's only 5 people with symptoms.
Yeah.
I wish we had the data to see how many had symptoms.
Yeah.
Put it this way, that I know that the Secretary of Defense, who was speaking today, knows what he's talking about. And now he didn't use numbers. He said a majority of the people that tested positive, so a majority of the 615 people that tested positive are asymptomatic. So that means over 308 of them, 308 or more of them, are asymptomatic.
Yep.
And that seems to be a salient fact that we should all pay attention to very closely, especially if you're talking about getting back and assimilating with other people in society before we have a vaccine, before we have a treatment, and before we have widespread testing.
Yep.
Widespread and available testing.
Yep.
What are your thoughts on that?
Well, I think in regard to this Roosevelt, it is scary that the asymptomatic could spread it and not know it. I think the reassuring thing with these numbers here kind of dovetails into what we talked about last night, as far as the obese Americans being more prone to being admitted to ICUs. And so, as you'd like to think of it, you think of crew members on these ships, and they're not the obese demographic. They're the 20 to 30 something probably demographic, and they're probably all not obese because of either lifestyle or because of requirements of their role in the military. And so these people, they're not being admitted. So this reinforces, I guess, some of the opposite, the people that are obese, that are at increased risk. So it's good to know that these people aren't that sick, but the downside is that the sword cuts both ways, is they can spread it just the same though. And that's the thing that I think you're scared of, or which is alarming. So.
Yeah. All right. Well, thank you for looking at and pulling those numbers.
Yeah.
What else did you get for us today?
So yesterday we had led off asking about some of the local numbers and our normal run through there. And I guess we can do that very quickly, but then that kind of led us into wondering about the surrounding counties in the state of Alabama, which I have ready to share as well.
Oh, good.
So locally here, we are still about 6.7% positivity rate, with 261 cases, up from 247 yesterday. And we've kind of made a little bit of a leap on hospitalizations, from 19 on Sunday to 21 to 20, actually 19 on Monday to 21 to 24 today. And, I keep saying that, that's 24 hospitalizations over, however 5 weeks that this has been. Well, you would presume that leap of 5 is 5 new hospitalizations in the last couple of days. So those people are probably hospitalized now. And then 4 deaths locally, and then the long-term care facilities are up to 49 linked cases in some way, either people who reside there, or people who are employed there, or people who visit there. And so that's continuing to go up. So those are the numbers there. Let me go ahead and pull up this. The state of Alabama has a similar website to what we've got here that we've been looking at for Florida and some of the other counties. And I will say this, I think last night I had mentioned when we were discussing this all, that you said, oh, what's going on in Mobile? And I did make a comment that Mobile had one of the highest numbers. And sadly, Mobile County has the highest amount of deaths in the state of Alabama by county.
Wow.
They have 17. So they lead the state as far as deaths per county, with Jefferson County being next at 16. As far as amount of diagnosed cases, they're second in the state. So Mobile County is right up there. Baldwin is not as bad. Mobile County's got, if I can click on it here. So Mobile County, it shows that, let's see here, the characteristics. Let me see if I can do this without, oops. Of course, I'm screwing that up, sorry. So they have 549 confirmed cases in Mobile County with 12,
wow.
they're saying 12 deaths on here, actually reported deaths 19. So it's gone up since I researched it today. So they probably had a late
Wow.
afternoon release like we've been having here for Florida. I just hadn't looked at it yet. So that's what's going on in Mobile County. So there are a lot of cases there, 549 in their county, and our county, Escambia, is 260. So it's,
wow.
And then if I click on Baldwin here, it's real sensitive. Baldwin is 93 with 2 reported deaths. So there is a county between the two of us, but I consider Mobile, both of those to be like almost one big county.
Right.
And I can click on Escambia County, Alabama, and show that they've had 11 cases with 0 deaths.
Okay.
So I don't know if there's any other ones that you wanted me to look at.
No, those were the ones that surround us.
Yeah. So Mobile County was the one that caught my attention last night when you brought it up, and I knew that there's a reason why, because I've been, reading enough headlines that one stuck somewhere in my brain. But we'll share this link today as well if people are interested in the Alabama numbers. I know we shared the Florida link last night, so people at home can kind of drive between the two if they're curious, or if they want to know what some of the trends are and compare the different state data. Okay.
Very good.
So that's as far as the demographics and some of the numbers. And then I guess the other thing I saw in the news today locally was that I believe Rick Outson had I guess made some progress as far as getting the name of the facility that some of the linked cases were associated with in the county here in the city. And then PNJ is also on the front of that as well, reporting, I believe, at least one other facility. So it's like 3 facilities I think have been named or linked with some sort of the diagnoses of the 49 that are been associated. So check out your local publications for that information there.
It was 3, you said?
3 since last week. I know Rick named one, PNJ named the same one Rick did, in addition to another new one.
Well, Southern Oaks is what they named, right?
That's the one that Rick had, and PNJ also carried that over. And then PNJ also had Brookdale, I believe, and Arcadia from last week, I think was one of the links that they had made. So I guess you want to get caught up.
But they
on
don't
all
give
the
you,
details.
they don't tell you the number of cases. They don't tell you if it's employees or, yeah.
No, and I think some of that is, the reporting that the publications are doing to talk to people who are family members of residents of these facilities to say what they were told. Oh yeah, we were told one of the employees, or this employee works here but also works there, that kind of stuff. So it's a little bit nebulous, but yeah, nothing's being produced that says X amount of residents and Y amount of employees and Z amount of vendors or anything like that. So that's not being published right now. So that came out. So then the other thing I wanted to share, and I guess this kind of goes along with something I know we talked about yesterday about, closing the schools, and social distancing, and there's some pushback, and there's actually some publications coming out with the query of, is school closure something that you need to do in every community? Does it need to be like on a statewide basis? Can it be like more countywide and more tailored? And one of the studies that I'll show you on here, or publication rather, let's see here, talks about just that. And so they're talking about the impact of school closures on the U.S. health workforce and net mortality. Okay, so the interpretation here: School closures come with many trade-offs and can create unintended childcare obligations. Their results suggest that potential contagion prevention from school closures needs to be weighed with the potential loss of healthcare workers from the standpoint of reducing cumulative mortality, like in the community, due to the absence of mitigating factors. And
So if the nurse or doctor can't come into the hospital because they're staying at home with their kid because the school's closed and they can't find, there's no other place to care for the kid, then that could maybe cause more deaths than having the kid at school.
yeah, and so that's one. And let me pull up the other study that had an interesting quip in it, and it was here. And so these people here say, let me get to the last page here. Let's see here. Oh, let me switch over to a different one. I apologize. I had like 3 different ones. So this one here, actually, the impact of unplanned school closure on children's social contact. And
Yes.
basically they say their whole premise, and we're going to link all these things so you can read through them if you're interested, but I've read them all. And basically they're saying that basing policy on historical patterns may give false confidence in results. There's finding that many of these kids are basically, it's a holiday from school. So it's a short-term closure, and then the kid is the human behavior is complex. Understanding how people respond to an evolving urgent policy is essential. And these kids are basically going home, but that not staying at home. So they're under the care of maybe a neighbor because mom or dad had to go to work, and the neighbor's not going to be the meanie and say you got to stay home. And then all of a sudden these kids are out running around the neighborhood,
socializing with other kids.
Yeah, and
at somebody else's house having a play date or whatever.
Yeah, and they say it best probably on this first page. So let me go back there without making you guys too dizzy. Apologies. They really sum it up right here. So right here, evidence suggests that many children continue to leave home and mix with others during school closures despite public health recommendations to avoid social contact. This review of behavior during unplanned school closures could be used to improve infectious disease modeling. So the idea of mom or dad can't go to work, and maybe they work in some aspect of the health force, whether or not they're a doctor or nurse, they are a cog in the machine of healthcare delivery. So they can't go to work, and then they stay home, and then their kid is exposing them to potential illness because the kid is out and about during the day anyhow, where they would have just been safer at school. So there's some pushback coming on this, and it's not to say the school closures are bad, but it needs to be measured and weighed by community and by the need in the community, and how impacted a community is. So if you're one of these counties in Alabama, for instance, we just looked at, like Escambia County, Alabama has 11 cases. Would you shut the schools there? I don't know.
Well, it goes back to the asymptomatic carriers. I'm not sure. I frankly feel that until we have a test and until it's available, widespread, and reliable, I think everybody should be very careful. I mean, it's just, even if you're going to open your office back like here, I think it'd be dumb for us to put a full staff in the space. You're asking for problems. Until there's a way to test people in a widespread, reliable manner, I'm not sure we can do this intelligently.
Yeah, I agree with
not unless somebody develops a vaccination or treatment overnight, and then it won't matter so much if somebody gets sick because you just take a pill and it's gone, or get a shot and be immune to it.
Yeah, and this, I'll bring this up because I've seen a couple of interviews that mention just that, and then the counter to that is, well, why don't we just wait until we have population or herd immunity? And we spoke about this about 2 weeks ago now, and I'll remind everybody that herd immunity means that in the United States, with 330 million individuals, we need 200 million people to be infected at some point or immunized.
That is not a good idea.
Yeah, herd immune. No, it's not a good idea, but it's nowhere near. That is a long way off. That's my point.
Mm-hmm.
I mean, that is a long way off, even with immunization. So the stopgap to that is everything you've mentioned. It's being cautious in the physical distancing, and not being too proud to say, hey, I'm not feeling well, I need to stay home. And the employers need to say, yeah, and you do need to stay home, and we'll go out of our way to make it so that you can work from home, or so that you don't lose your job because you missed one day.
My theory is, I'm not the president, I'm not the mayor, I'm not a politician. I don't control any amount of people other than my staff. And if I tell my staff that they have to come into the office, and then my staff gets sick and, heaven forbid, gets put in ICU and doesn't make it, and the family's like, well, that law firm made her go to work despite knowing all this stuff. I don't feel comfortable being in that position.
No,
I'm not going to mandate my people to come into work until I can guarantee it's a safe place, because being open means being open to the public to see new clients. And I'm not comfortable exposing my staff, even if I know they're all okay. Let's assume that they all were tested, which they haven't been, and we all know that they don't have it, and it's been recent. I'm still inviting other people into the office, whether it's a delivery person or a vendor or a potential client or a client, how another lawyer, a court reporter. How can we do that until we know for sure we're not exposing these people to something that could be deadly to them or their family? I mean, so anyway, I guess you could get your staff to sign releases potentially. I mean, that's one way around this, but I mean, who wants to get engaged in that kind of stuff? I certainly
provide no shortage of like bleach cleaning supplies and all that kind of surface stuff.
Yeah, and maybe stagger the staffing so that you only have a skeleton staff here at any one time, so that nobody's within 20 feet of each other at any particular time, and or stagger the days that you have certain people in, so that you're not everybody's working remotely every day. Maybe something like that, but you're still taking a chance that you weren't taking in the last 5 weeks. I mean, hell, we've been working remotely for 5 weeks. We hadn't missed a beat, except for the downturn in the number of people driving and having wrecks. I will say though, I drove in to the office a couple of times today, and when I drove in this afternoon, I looked up Palafox, and Palafox did not look like a ghost town today. There were cars on both sides of the road, and I don't know where they were, but it looked like more people were out today. I think people are starting to feel like this is over, and they're getting messaging from the White House and some other officials that we're going to be officially open for business, I guess, in a couple of weeks. And so people are thinking, oh, this is over. This wasn't that big of a deal. And nobody I know got sick. And we blew it out of proportion. Everybody's going to get back to try to jump back into this. I think that's a mistake. I'm going to be a little more cautious with my staff, and I'm going to wait a couple of weeks before I say everything's okay, especially if there's a grand reopening of the country or something, or this state, if our governor decides to reopen the state. I'm not going to do that. Not until we have testing in some way to reliably know who's got it, or a vaccination shows up, because
or the antibody testing too.
Well, even the antibody, they're saying antibody testing, since they don't know whether somebody can be reinfected yet or not, they're not sure even that is a reliable way to know what's going on. But anyway, all right. Well, so what were you going to say?
Well, and you kind of touched on some things that I read on today, though I wasn't really ready to present anything really, because I needed to find something more reliable. But it's being termed like unlocking, and so it's like a staggered unlocking on every level. So it's for you, for the law firm, it'd be a staggered unlocking in your firm, and then for the city, it'd be a staggered unlocking, or a local jurisdiction, and then on a state level, unlocking. So talking about staggered unlockings, and it's how do you mandate it? But you have to advise it. But there were some models that showed that without the staggered unlocking, that you have another peak. and you have another peak 2 or 3
Dude,
months later.
if you throw hundreds of people into a church, for instance, you are asking for problems. I mean, I'm
Yeah.
sorry, but that's just the way it's going to be. Or you throw hundreds of people into an arena for some event, or even jury duty. You can't put jurors into a jury assembly room on a Monday morning and say, and you're sitting 2 inches from the next person, and reliably put them in that situation without knowing there's a test method out there that everybody can go through, or there's some treatment available. You can't do that. That's too much of a risk, in my opinion. I'm not sure who's going to make that call, but I wouldn't make that call. There's no way I would do that. So anyway, all right. Thank you for the information tonight. We'll be back tomorrow.
I'll get that staggered stuff for tomorrow. See if I can find something reliable to present, something that's digestible as well.
Okay, very good. We appreciate your work today. Thank you very much. Thank y'all for watching. We'll be back tomorrow. If you have a question about a case, you can always call us at 855-HIRE-JOE. You can find us on the web, of course, at zarzaurlaw.com. And if you have questions about what we talked about today or in any of these other videos, you can comment under the video itself. There's Facebook, and there's info@Zarzaur Law if you'd like to email us. Y'all take care and be safe. We'll see you tomorrow. Good night.
Bye now.